So sometimes we are going to administer epinephrine as an infusion. So in that case, we're going to either take a 100 milliliter or 250 milliliter bag of saline, and we're going to mix 1 milligram of epinephrine into it. You can use either. Agencies might have a practice or protocols. We're going to do infusions in another video, but we'll go through the difference infusion rate based on the volume. But for now, I just want you to take away how we're diluting epinephrine. So the other thing that can also be used is a push dose pressor dose of epinephrine. Now, if you're watching this locally, that is not in our protocols now, but it is in some neighboring protocols. And what I really, good, bad, whatever, what I want you to take away is how diluting epinephrine affects the concentration. So we're going to take our 100 milliliter bag. We're going to take our 1 milliliter of epinephrine, 1 milligram per milliliter. So 1 milliliter of this vial, 1 milliliter of this vial. We are going to inject that into our 100 milliliter bag, agitate it, and label it. And now we have 1 milligram and 100 milliliters, which makes this concentration move the decimal point over 0.01 milligrams milliliters. So this part is not, the other concentrations are on the vials, and we can go off of that. When we're mixing medications, though, we're not going to have that. We have to calculate that ourselves. And so when we set up our dose, if we want to give 2 micrograms per minute of epinephrine, we're going to do later, we're going to have to convert milligrams to micrograms. The other thing is we're going to give this, as you can give this as an infusion, set this to a drip rate, or put this on a pump. But the other thing that you can do is do a push dose epinephrine, where your patient is in not in cardiac arrest, but they're in shock, they're hypotensive, maybe they were resuscitated from cardiac arrest, or they have sepsis, something like that. We take our 1 milligram and 100 milliliter concentration of epinephrine, or 0.001 milligrams per milliliter, and we can administer this as a slow IV push. So we would use this as our new vial. Take this, tape the vial to it, tape the vial to it, label. This is our new source, and we can draw medication from here and give this, push this into the patient's IV slowly. So remember, I said we are never going to take this vial directly or this vial directly and inject this into a patient's IV unless we dilute it. So we diluted this. Either if we needed to use this for cardiac arrest because of a drug shortage, we diluted this. So we had 1 milligram in 10 mLs, which makes this the same as the gray box. Use the gray box, or if we're going to give the live dose, where we're trying to support someone's blood pressure or their bradycardia, we're going to mix this. Now we have our 0.01 milligram per milliliter, and we're going to draw from this, whatever your local protocols or practices are. Okay, now we're going to show you another way to set up the epinephrine push dose IV push for bradycardia or hypotension in a live patient. Before we do that, I'm just going to say that if you're doing this, I believe that using the 1 milligram and 100 milliliter bag is the best way. It's the safest. And if you need a second to put the label on. If you tape a vial of it to the bag, everyone knows that that's epinephrine and not normal saline. But there's some other ways that are being used. And the biggest takeaway from this is just to understand concentration and dose and volume, that these lessons can be applied to other medications as well. So when we said we put 1 milligram in 100 milliliters of saline, our dose then is, our concentration is 0.1 milligrams for milliliters. And we got that 1 milligram, 100 milliliter bag. Well, how can we get that same concentration? Well, we can take our gray box epinephrine, put it together, and in this, what I'm holding now has 1 milligram of epinephrine in 10 milliliters. So 1 milligram, 10 milliliters, and if you can see the concentration, it's 0.1 milligram per ml. So that's the concentration that we want. So we could take 10 milliliter saline flush, which has 10 milliliters of normal saline in it, eject 1. We're going to squirt out 1 ml into a suction canister, garbage can, whatever we have available. So then we have 9 milliliters of saline in here. And then we can take our 1 milliliter of epinephrine, which we know from the concentration is 0.1 milligrams per milliliter. So if we inject 1 milliliter into this 9 millimeter saline flush and agitate it, now in this flush we should label or tape the vial to, or tape the empty Bristojet to, so that we know that we now have 0.1 milligrams, and our volume is 10 milliliters. Our new concentration is 0.01 milligrams in 1 milliliter. And whatever your protocol say, now we would administer this as an IV push slowly based on protocol, or looking for a desired heart rate or blood pressure effect. So that's 2 ways to dilute epinephrine. And then to mix them, so if we injected, to do that, in order to mix the two, if we wanted to squirt 1 milliliter into the saline flush, we could use a male-to-male adapter, and whichever one that still has the epinephrine and whichever one we squirted out, you could mix them this way. Agitate. There's also the 3-way stopcock, that whichever has the 1 milliliter of epinephrine, inject that to mix. Now you have 10 milliliters of 0.01 milligram per milliliter concentration.